Did you know that about 75% of women experience pain with sexual activity? But how many women actually not reporting their pain with sex? Today I would like to talk to you about different reasons for experiencing pain during sexual activity. Vulvodynia literally means pain at the vulvar area. Vestibulodynia means pain at the area of vestibular, like right before the entry into the vagina. And vaginismus, it's an uncontrollable contraction of the muscles surrounding the vagina right before the anticipated vaginal penetration. The best way to think about it is in layers of anatomy: skin level, vaginal health, muscles, nerves, and organs. So let's start with the skin. Skin is the first point of contact. So any irritation, any issues with the skin will cause discomfort. For example, ligament sclerosis, this chronic skin condition, ligament planus that can affect the skin and it can affect inside of the vagina. Genitourinary syndrome of menopause, or simply just changes associated with menopause with hormonal deprivation. Similar changes can happen when you're breastfeeding or when you're taking oral contraception pills for a long period of time. And not to mention sexually transmitted infections. For example, herpes virus can create very painful lesions that will hurt before the outbreak and after outbreak. Moving to the second layer is the vaginal health. There are multiple things that can affect vaginal tissue. For example, being menopausal, when there is a vaginal dryness, not enough lubrication. And in those cases, using vaginal estrogen or vaginal DHEA can be very helpful and improve the quality of sexual life. And I also mentioned oral contraception pills that decreasing the levels of estrogen and testosterone and can cause similar symptoms to the menopause, like vaginal dryness. And actually, it's not only oral contraception pills. Other types of contraception like hormonal IUDs or hormonal implants or NuvaRing can cause the same symptoms of the vaginal dryness. There are also some medication, for example, antihistamines will dry you out is the same way as it will make vagina very dry and uncomfortable. So make sure to use plenty of lubricants. There are multiple types of infection that can affect the vagina. Bacterial vaginosis of different types, yeast infections. And having that infection will cause inflammation, irritation to the vaginal canal, and will cause discomfort during sexual activity. So it's very important to treat those infections first. Moving on to the muscular layer. Our pelvis is lined up with the muscles and ligaments that supports our pelvic organs like bladder, bowel, vagina. Collectively, those muscles known as pelvic floor. The issue with those muscles can cause pain on initial penetration because those muscles come very close to the vaginal opening, or they can cause pain on a deeper penetration. So if there is any dysfunction in those muscles, they're too tight or too loose, we might experience symptoms from those organs that they support, like urinary urgency, frequency, pain with bowel movements, or pain with sex. A lot of these symptoms might present the same way whether you have a very weak pelvic floor or very hypertonic pelvic floor. So make sure that you get evaluated by your gynecologist or pelvic floor physical therapy to address your particular condition, because the treatment for both are different. It's important to mention the condition called vaginismus, which is involuntary contraction of the pelvic floor muscles around the vagina, making intercourse very painful or even impossible. There are multiple reasons to develop vaginismus. Some of the common ones is prior emotional or sexual trauma, and also just having hypertonic pelvic floor muscles. And similar how those muscles support our organs, the nerves also go through those muscles. So whenever there is an issue with the muscles, the nerves might be affected. They might be contracted by those muscles. and we will have the symptoms in the areas that those nerves are innervated. For example, pudendal neuralgia, when we have a pain in the areas of innervation by pudendal nerve, one of the main nerves of the pelvic floor. Pudendal nerve has three main branches that go to the clitoral area, to the vaginal opening, to the rectal area. So if there is any issues with that nerve, we might have a pain or discomfort or malfunction in those areas. There is also a condition when some women, for unknown reason, have more nerve endings in the area in the vestibular, at the vaginal entry. And that area is very sensitive whenever anything touches it. It's called neuroproliferative vestibulodynia. Some women are born with that, and some women develop it due to the exposure to multiple infections or treatment for those infections. So in those cases, again, it's very important to see the specialist who knows about those conditions so they can do appropriate evaluation and testing. Because treatment for that particular condition is very specialized. It might involve some topical medications and surgery. But keep in mind that not all pain with sex is gynecological in origin. There could be other causes, issues with your back, issues with your spine, brain. If there is a suspicion that you have some nerve pathology, it's very important to look at the higher up levels, level of your back, level of your brain, and get a full body evaluation. Common anatomical reason that can cause pain with sex is having pelvic organ prolapse, when the organs are shifted from its normal position. In that case, you might experience some discomfort, some burning, or even not able to have sex in a certain positions because the organs are on the way. And let's remember, our bladder is very close to the vagina. So any issues with your bladder, urinary tract infections to urinary incontinence to interstitial cystitis will affect your pleasure, will affect your sexual activity. And let's not forget about rectum. Conditions that affect the area, like inflammatory bowel disease, hemorrhoids, might cause a lot of pain and also be very uncomfortable during the vaginal penetration. One of the common reasons for developing pain with sex is endometriosis. Endometriosis is when the inside lining of the uterus, instead of being inside of the uterus, located outside of the uterus, like on the abdominal wall or bowel or bladder. During your menstruation, inside lining of the uterus is shedding, being your period. It's not only happen in the uterus, it also happens everywhere where you have that endometriotic implant. Bowel, bladder, inside of your stomach. And it can cause a lot of pain, inflammation, and form a lot of the adhesions. And that will cause pain anytime you experience like deeper penetration. You might also have heard about the term endometriosis. It means that internal lining of the uterus that shed with your period migrate into muscular layer of the uterus, so that period blood being shed inside of the muscles, also creating pain and discomfort. In addition to endometriosis, a lot of women might have fibroids. Fibroids are benign tumors of the muscular layer of the uterus. Some fibroids very small and doesn't affect anything, but some fibroids might be very big and depending on its location can press on your bladder, on your vagina, on the rectum. So during sexual activity, it can cause additional discomfort. Pain with sex is common but never normal. We talked about different reasons for experiencing pain. And it's very important to get diagnosed and find the reason for your pain because the treatment options are different. So talk to your doctor so you can go back to enjoying your intimate life.